The alarm went off at 6:15, same as always. She reached for the nightstand, found the glass of water, found the pill, swallowed it without thinking, the way you do something you've done 10,000 mornings in a row. By 9 o'clock, she was sitting at the kitchen table and couldn't remember the word for the thing she used to stir her coffee. By the following month, she couldn't remember whether she'd eaten breakfast. By the month after that, her daughter had taken her to a neurologist. Who ordered the scans? Who ran the tests? Who sat across from the family and used the word that no one is ever ready to hear? But here's what none of those doctors asked. What if it wasn't the disease? What if it was the pill she'd taken faithfully for 11 years, the same pill, same dose, same brand, that had stopped working the way it used to, not because the medication changed, but because the body receiving it had? That question changed everything. And it is exactly the question I want you to be able to ask. Because after 65, your body processes medication in a fundamentally different way than it did 10 years ago. Not slightly differently, not theoretically differently, measurably, physically, chemically differently. And the dose on that prescription bottle, the one your doctor wrote, was almost certainly calculated for a body that no longer exists. Stay with me, because in the next few minutes, I'm going to show you the science behind why this happens, step by step. And around the 9-minute mark, I'm going to tell you about a specific medication, something sold freely at every pharmacy in the country, something that millions of people over 65 take for sleep, for allergies, or for pain, that the American Geriatrics Society has placed on a formal warning list of drugs that should be avoided after 65. Most people taking it tonight have no idea that list exists. That is what I want to make sure you know before this video ends. I've spent decades in geriatric medicine, working with patients over 65, studying what happens when the body and its prescriptions stop being properly matched. What I'm going to tell you isn't alarming for the sake of it. It's the kind of information that should be in every clinic room, and too often, never makes it there. Let's start with what's actually happening inside your body. Because before we talk about what to do, you need to understand what you're dealing with. Think about how a medication works. You take a pill. Your body absorbs it. Your bloodstream carries it to wherever it's needed. And then, and this is the part most people never think about, your body has to get rid of it, clear it, flush it out. And that job falls almost entirely to two organs, your kidneys and your liver. Think of your kidneys as a filtration plant. Every minute of every day, they clean your blood, pulling out waste, pulling out chemicals, pulling out medication after it's done its job, and sending it out through your urine. When that system runs well, a drug enters your body, works for a few hours, and leaves cleanly, on schedule, in the dose your doctor intended. Here's what changes after 65. From around the age of 40, your kidneys lose roughly 1% of their filtering capacity every year. Not because something is wrong, because this is what aging does. By the time you reach 75, the average person is operating with 35 to 40% less kidney function than they had in their 30s. Not a failing kidney, not a diseased kidney, just an aged one. And that is completely normal. But here is what that means for your medication. That drug you've been taking for years was prescribed based on how quickly a typical body clears it. A younger body, a body with full kidney function. If your kidneys are now working at 60% of their original capacity, the drug is not leaving your system on the same schedule it used to. It is building, quietly, day after day, until the concentration in your blood is higher than your doctor ever intended. The medical term for this is an extended half-life, the time it takes your body to eliminate half a dose of a medication. I want you to write this down because it matters enormously. For some drugs, the half-life in an older body is double what it is in a younger one. For others, it is triple. There are medications that take 20 hours to clear a 40-year-old system and 60 or 70 hours to clear yours, and no one updates the label. Your liver tells the same story. Blood flow to the liver decreases by up to 40% by your mid-70s. The enzymes your liver uses to break down medication, a system called cytochrome, P450, which processes the majority of all prescription drugs, become less active with age, slower, less efficient, more drugs passing through partially metabolized, more time spent in your system than the prescription was designed for. And then add one more layer that almost nobody talks about. Your body composition has changed. You carry less water than you did at 50. You carry more fat. This matters because drugs behave differently depending on whether they dissolve in water or in fat. Water-soluble drugs, without as much water to dilute them, become more concentrated. Fat-soluble drugs, and this is the important one, have more places to accumulate, which means they stay in your body longer than anyone calculated. The pill your doctor prescribed was written for your body at a different age. You have been faithful to that prescription. But your biology has quietly moved on. And when no one adjusts for this, something can happen that I need you to understand, because it may be the most important thing in this entire video. There is a pattern that geriatricians see again and again, a pattern that has a name, and until you know what it is, you won't be able to recognize it if it's happening to you or someone you love. It's called the prescribing cascade. Here is how it works. A medication causes a side effect. The patient feels something real, a symptom they report to their doctor. But because the symptom looks like a new medical problem, no one connects it back to the medication. And so the symptom gets treated. A new prescription is added. That second drug causes its own side effect. Again, it looks like something new. A third prescription follows, a fourth, and the chain keeps going with no one stepping back to ask, what started this? Let me make this real for you. I want to tell you about a patient. I'll call her Margaret, who was 71 years old when she was prescribed a blood pressure medication, a calcium channel blocker. It worked well. Her blood pressure came down. But one known side effect of that medication is swelling in the ankles and feet. Margaret's ankles swelled. Her doctor saw it and prescribed a diuretic, a water pill, to bring the fluid down. The diuretic worked on the swelling, but it began quietly depleting her sodium levels. And low sodium in an older person affects the brain. Margaret became confused, forgetful, shaky. Her doctor ordered cognitive tests. She scored poorly. She was referred to a neurologist. The neurologist diagnosed early-stage dementia. A memory medication was prescribed. Margaret was now on 4 medications. She started with one, and she did not have dementia. She had a prescribing cascade. When someone, in this case her daughter, who happened to be a pharmacist, traced the chain back to its origin and asked the question no one had asked, the picture became clear. When the diuretic was removed and her blood pressure was managed differently, Margaret's sodium normalized. Her cognition returned. The confusion lifted. The shakiness stopped. 3 weeks. That's how long it took to reverse what had been called dementia. She had been faithfully taking 4 medications for a condition caused by the first one. Have you noticed new symptoms in the last few months that no one has connected to a medication you're already taking? I want that question to sit with you. Because symptoms that are quietly dismissed as just getting older, the fatigue, the foggy thinking, the low mood, the unsteady balance, are in many cases drug side effects. In an older body, where drugs accumulate longer than expected, the symptoms can look exactly like aging. And that is exactly why they go undetected. Now, I told you at the beginning that there was something I needed you to know before this video ended. Something sitting in most medicine cabinets. On the Beers criteria, the American Geriatrics Society's formal evidence-based list of medications considered potentially inappropriate for anyone over 65. This is not an obscure list. It has been updated regularly since 1991 by some of the most respected geriatricians in the world. And yet the majority of older adults taking the medications on it have never been told it exists. Near the top of that list is a category of drugs called anticholinergics, medications that block a specific chemical messenger in the brain. They affect memory, coordination, reaction time, the ability to concentrate. And in older adults whose brains are already working with a blood-brain barrier that is more permeable than it used to be, meaning more of everything crosses into the brain. The effects are magnified. The most widely taken anticholinergic drug in the country is not a prescription. It is diphenhydramine, the active ingredient in Benadryl, in Tylenol, PM, in Zizquil, in most over-the-counter sleep aids and antihistamines. In a younger body, diphenhydramine is processed efficiently, it does its job and clears, and in your body, after 65, it does not clear on the same schedule. It accumulates. It crosses into the brain more easily. And the research is unambiguous. Regular use in older adults is associated with confusion, short-term memory impairment, difficulty concentrating, increased fall risk, and cognitive symptoms that, in study after study, have been mistaken for early dementia. A medication you can buy without asking anyone, without a prescription. That is listed by the American Geriatrics Society as potentially inappropriate for anyone over 65. And the most frightening part? The symptoms it causes look nothing like what's on the side effect panel. They look like aging. Your body has not failed you. I want to say that clearly before we go any further. Your kidneys are doing exactly what kidneys do over time. Your liver is doing the same. Your body composition has changed the way bodies change. None of this is failure. None of this is disease. It is biology. The failure, if we're going to use that word, is that the prescription system was designed around a body that doesn't change. The drug was tested, approved, and dosed for people who were not you, at an age you no longer are. That is not your fault. But it is your responsibility to know about it, and knowing about it gives you real power. 3 specific, actionable things you can do, not eventually, not at your next physical in 6 months, this week. The first is a kidney function conversation. Ask your doctor to order a simple blood test called a serum creatinine, which estimates how well your kidneys are filtering. 1 number. It takes 30 seconds to order, and it can tell your prescriber whether the dose of every medication you're on is appropriate for the kidney function you actually have right now, not the kidney function you had when the prescription was first written. The second is the brown bag review. This one is free and you can do it without a doctor's appointment. Take everything you put in your body, every prescription medication, every over-the-counter drug, every vitamin, every supplement, every herbal remedy, and put them all in a bag. Bring that bag to your pharmacist. Most pharmacies will sit down with you and review the whole list. A pharmacist is specifically trained to identify drug interactions, duplications, and medications that may be inappropriate for your age. They often catch things a busy doctor's appointment never gets to. The third is 1 question. A single sentence you can say at your next appointment, or your next urgent visit, or your next telehealth call that changes everything. Write it down. Could this symptom be caused by something I'm already taking? Not accusatory, not challenging, just the question. Because that question, asked at the right moment, is what breaks the cascade before it starts. Let me bring you back to where we began. She reached for the pill on the nightstand, the one she'd taken 10,000 mornings in a row. And what happened next wasn't the medication failing. It was the medication meeting a body that had changed, quietly, normally, invisibly, in ways the prescription had never accounted for. Her body hadn't betrayed her. The instructions had simply never been updated. If you came to this video feeling like something isn't quite right, the fatigue that sleep doesn't fix, the fog that comes and goes without explanation, the balance that feels a little less certain than it used to, I want you to know that your instinct to ask questions is correct. Keep asking. The information in this video is yours to take into that next appointment. If someone you love is over 65 and on 5 or more medications, please share this with them, not to frighten them. Because fear closes doors, and what I want to give you is a key. Before you watch anything else today, I want to ask you to do one thing. Go to wherever you keep your medications, the cabinet, the drawer, the shelf above the kitchen counter, the bag at the bottom of the closet. Take everything out, every prescription, every supplement, every over-the-counter bottle, every vitamin. Lay it all on the table. Count it. Remember that number, because next week I'm going to tell you about a study where researchers asked a group of seniors to do exactly that and then recorded what they found. They called it the brown bag study. And the results, the actual numbers, the actual combinations of medications these patients were carrying without any doctor having seen the full picture, changed how every single one of those patients was treated afterward. One woman counted 23. What number is on your table? That video goes live next week. I don't want you to miss it, because what they found goes further than medication. It gets into what those combinations were quietly doing to their bodies over time. Subscribe and turn the notification on. I'll see you there. One important note before you go. Everything in this video is for educational purposes only and is not a substitute for the guidance of your personal physician. Please do not stop or adjust any medication without speaking to your doctor first. If you have concerns about your prescription list or any of the symptoms we've discussed, bring them to your healthcare provider. That conversation is not a burden. It is exactly what they are there for.